Good afternoon, everyone. Welcome to the Advice Media webinar this month. My name is Chad Erickson. I'm the Vice President of Business Development and Marketing here at Advice Media. It's my pleasure to welcome all of our attendees in today. We hope everyone's having a wonderful fall season. We know that we're also in the busy trade show season. So if you're attending any conferences over the next couple of weeks, please look us up. We're going to be at AAO. We just completed AAID. We'll be in Vegas with LVI, heading to the ASOPers conference, as well as PPMD. We'll be at ISAPS next weekend. Anyway, we've got a ton of great conferences, so please come by and say hello to us at the meeting. We look forward to connecting with you. This afternoon, we have a great topic, and I'm very excited about this because it's a topic that I get asked about on a frequent basis, and it's something that I don't know that much about. And so I'm actually looking forward to learning a ton about this today, particularly on the regulation side, to make sure that not only are we compliant, but that our clients and prospective clients are also doing the things to be compliant, that you don't get yourselves in trouble on what really is an amazing technology and something that everyone should be incorporating into their practice. But I'd like to introduce our speaker today. Her name is Leah Chatham, and Leah is the Director of Content Marketing at Solution Reach. The company is revolutionizing the healthcare experience for providers and their patients. She's responsible for developing educational resources to help medical practices improve their patient-provider relationship. Leah spent over 5 years leading engagement at a small integrated health system and has 15 years of experience developing educational content for leading patient engagement, practice management, and EHR companies. I've had an opportunity over the last little while to get to know her a little bit and to talk about her experience. She's bringing 20 years plus of experience to our webinar today. One of the brightest minds I've talked to. Looking forward to hearing from her. Leah, thank you so much for taking time. Go ahead and take us through this awesome topic today.
Oh, thank you so much, Chad. I'm so glad to be here, and thanks for that nice introduction. And I don't know, maybe I should pretend like I've been in healthcare less time because it's starting to make me feel old. Everybody's sort of like, oh, 20 years of experience.
No,
Then when I hear someone else say it, I think, oh, wait.
No way. You know, people are like, gosh, you know, you're getting older, you got these wrinkles. I'm like, I earned those wrinkles. I'll keep them. They're great. So you've earned your battle wounds, Leah. So
oh, good.
No, your knowledge is.
That my daughter loves to point out. Oh, Mommy, you look wrinkly. So welcome, everybody, and thank you so much for joining us. This is a really interesting topic. We get asked about this all the time, and so it's a topic we like to talk about because I think a lot of people do feel nervous or fearful or worry about being compliant, but everybody knows that texting is kind of the future, if not the present, both in healthcare and outside of healthcare. And so it's a great thing to be able to be here and talk to you about today. And it's something we talk about quite a bit. So I'm happy to have you follow us, whether that's following Solution Reach or following me. We share a lot of information about texting, about patient communication and practice marketing and patient engagement and those kinds of important topics. So we share information that we've created, but we also share information coming from a lot of other sources and leading minds in healthcare who are talking about these issues. So if it's something that is important to you and that you want to stay on top of, feel free to connect with us on social media, and you'll see, you know, content like this being shared out by us, and we're happy to connect with you or answer questions or whatever the case may be. And as Chad said, I've been doing this for about 20 years, about 15 years working in health IT with practice management and practice marketing and EHR companies, and 5 years doing patient engagement, patient communication, and marketing for a 20-physician integrated health group and hospital. So hopefully this is something I know quite a bit about, and you'll feel like you're getting useful, valuable information, knowledge, and tips from me. So we are going to be talking about text today, and we're going to talk a little bit about some generational differences, but I think you'll probably be surprised to find that there are actually more generational similarities than there are differences. And some more about kind of text preferences, what patients are looking for, and then how to do texting right so that you can stay compliant and make sure that you're not breaking the rules. I will say, I'm not an attorney. We have most of our content vetted by our attorney, but if you have additional kind of questions or concerns, it's always a good idea to get advice from your healthcare attorney. Make sure that the things you want to do are compliant. So the first thing, talking about kind of this generational issue that I want to say is even Larry Bird wants to text. In fact, 2/3 of this Celtics team, who now are baby boomers, want to text. They want to send text, they want to receive text. And you can see with the red circles here, that would be everybody who's circled. That's a lot, right? 2/3 of baby boomers want to get texts from their healthcare providers. And this comes from research that we did about 1.5 years ago, where we interviewed people across a variety of different types of practices. So we asked people about primary care experiences in dermatology, vision, and dental practices. So if you'd seen someone in one of those specialties in the last year, we asked a series of questions about switching behavior, about satisfaction and customer service. And we talked about kind of technology and tools that you'd like to have from your providers and things like that. And this data came out of that survey. But that's not the only survey out there or the only data out there kind of talking about baby boomers and technology and specifically texting. So adults 55 and over, so baby boomers tend to be people about 50 and over. Adults 55 and over send and receive on average 16 text messages a day. So this is from a completely separate study. There's quite a bit of data out there about baby boomers becoming the fastest growing group on social media. The majority of baby boomers have made the switch to a smartphone from, say, a flip phone or something like that. They are fast growing users of text messaging. So we tend to make these assumptions that if our practice is largely made up of people who are over 50 or over 55 or over 60, that those people are not tech savvy, that they are not using technology, and that's going to be a challenge for us if we start implementing these kinds of tools in our practices. And that's just not true. You will be shocked to find when you ask people about preferences, the number of baby boomers who actually are interested in using text. So why is that? It's really because we've been using these outdated modes of communication, like postcards and phone calls, and the rest of the world has sort of sped forward into using text and email. And the reality is that there's data that shows that as many as 90% of people now don't answer their phone. They just let it go to voicemail. They wait and maybe they check their voicemail or look back and see who called, and then they call or text that person back. About 20% of people say they never even check their voicemail. They just don't use their phone for that. They don't use it for phone calls. They don't listen to voicemail. That's just kind of the way they are. And the younger the person, the more likely that is to be true. And, I think if you stopped for a second and thought about, like if you stopped at Starbucks today, and you were standing in line at Starbucks, were the majority of people texting and looking things up on their phone? Probably. Those conversations now largely happen over text and not over the phone. And in fact, we were working on putting this data together and kind of gathering all of these other data sources around text messaging and beginning to do all this education around the increasing use of text and how to be compliant with text. And I happened to be watching the news, CBS Morning News one day, and they were doing a series on millennials and interviewing millennials about different topics. And one of the things that came up was this topic around text message versus phone calls. And somebody actually said, we had just written this saying invasive, outdated, ineffective, whatever, that it's, and the invasive part in particular. And this one goes, yeah, it's very invasive. It's really, I really perceive anything other than text messaging as rude. And granted, those are millennials, but the reality is a lot more people are feeling that way. So we need to be pulling ourselves into the next, into this next phase of communication. 72% of Americans own a smartphone, and 97% of people with smartphones use it to text message. Text messaging is by far the most used app on smartphones, period, like by far and away. And I wish I could remember the exact data on that, but it is significantly more than any other app that people use on their smartphones. So I'm going to stop for just 1 second to kind of clarify what we're talking about. So we're talking about regular text messaging, two-way text messaging back and forth, not secure messaging, not a solution that you have to separately log into with any kind of additional app or verification. So this is text messaging between your practice and your patients in the same way you text message back and forth with family and friends. So they are two different things. And when we're talking about the compliance piece, we're going to be talking about how compliance applies to unsecure text messages that are real text messages sent back and forth between your practice and your patients, not communications sent through a portal or communications sent through a texting solution that provides a link where you then need to log in and go to some kind of portal or secured page. So just to just to make sure that everyone is really clear on exactly what this is about, because they are different. And there are times where you need something that's a secure channel, and a portal can really serve that purpose. There are some secure texting solutions. Most of them do require people to kind of click on a link and follow through with some kind of process beyond that. But we're just talking about regular back and forth texting. So getting a little more specific from the research that we did, this is what we gathered when we asked people questions about text communications. And we did ask about a lot of different kinds of communications around reminders and recalls and other kinds of messages, and do you want to text back and forth and things like that. And this is kind of the summary of that data. So obviously, millennials have the highest level of interest in being able to text both to the practice and receive text back. But you can see again here, the numbers for baby boomers, around 60% want to be able to send and receive text messages. And that's a fairly significant number. And I think we're seeing that continue to grow. So this data now is a little over a year old. I think those numbers are just going to continue to get bigger and bigger. If we were to run this survey again next year, I would expect to see those baby boomer numbers go up. And really, there are a lot of people who are saying, I don't just want to get like an automated text reminder. I want to be able to respond. I want to be able to communicate back and forth and ask a question or, whatever the case may be. So when we do kind of break it down and we ask people, do you have this today versus, would you like to have it? Would you, what's the difference between kind of who offers it and whether or not you have it versus you don't have it? We see that there is a pretty big disparity between what patients say they have access to now and what they'd like to have. It runs about 30% difference between people who say, yeah, I have that, I can get that. And remember, most of these, for most people, are automated, right? So it's like an automated reminder or an automated alert or something like that. When you look here at the being able to text back and forth, that, is one that way less people say they have. But still about a 30% disparity there where people say, but boy, I would like to have that, or allowing patients to initiate text messages. Only 13% say, oh, I have the ability to initiate a text message with my healthcare provider, and 48% say I would love to have that, the ability to do that. And honestly, I'll say I think these numbers might be a little bit low because not everybody necessarily knows what that means, or maybe they think they know. And again, it comes back to this thing of, well, yeah, we get automated reminders, but that's what people are familiar with. I think it's becoming, people understand more what this whole idea about back and forth real-time text messaging is. And if we were to run those numbers again, we'd probably see a lot more people saying they want that, but still not very many people saying that they have it. Either way, 30% is a pretty significant disparity, or you could look at it as an opportunity. If patients really want to be able to have the ability to text back and forth and initiate text with the practice, and they want to be able to get all these text communications, being the practice that offers those text communication options makes you far more appealing. And one of the things that we found in the survey when we asked people about switching behavior, had you switched in the last year? Are you thinking about switching in the coming years? Was that while only about 12% of people said they had switched in the last year, closer to 30% or 35% of people said they were thinking about switching in the next couple of years. So, and when we asked people why they'd switched, a lot more people than you might think said it was because of experience and communication. So what we kind of found was a lot of people said, my office does a terrible job of communicating with me. The customer service isn't any good. I feel kind of like a number. They don't really know me. You know, I don't have a great experience or great engagement with the practice. In medical, so in primary care, those numbers as far as people switching were the highest. And then that was followed by dermatology and dental offices. And the office actually with the best sort of rates of engagement, so the least people leaving because of poor customer service, was in vision practices. But it was still about 25% of people said they left because they had a bad experience. It was like 20 to 25%. So that's still a lot. And so people generally said, what we'd really like to see in an ideal practice is great communication, like ongoing communication with patients, and options for communication, being able to get email and text, and feeling like they have great customer service. Outside of our survey, there was another survey a couple of years ago done by McKinsey that said that 53% of patients want the exact same customer service experience in healthcare that they get in retail. So it was not surprising that we saw that kind of response from people saying, I just want a better experience. And why not? I mean, they're paying a lot more out of pocket. Healthcare is becoming increasingly kind of pricey and inconvenient. Of course you want better, and everything else is becoming more convenient, right? I can go on my phone and I can book a ticket on Delta on my phone, get everything via text and sort of automated, you know, updates and all that kind of stuff on my phone without ever having to do anything else. And if that's your experience, or if your experience is that you can order things from Target on your phone, get a text message that it's ready, and just pull up to the front door and have somebody put it in your trunk, then that's an incredible kind of experience. Even in brick and mortar stores, people have a better, you know, you walk into the Gap and there's a woman there, you know, pretending to fold T-shirts, and she'll, hello, good morning, how are you? Can I get you a room? What are you looking for? You know, people are now having an expectation from healthcare that it's going to be that convenient and that the service is going to be that good. And texting really is becoming a bit of a cornerstone in that, because it is the thing that they get now with so many other experiences that they have out in the world. So to be able to do this kind of unsecured two-way texting the right way, it's important to understand what these privacy regulations are and how they work. Not surprisingly, and most of you probably know some of this because you've gone through HIPAA trainings. Really, the two categories around privacy regulations have to do with confidentiality and the right to be left alone, to be able to say, I don't want you to bother me. I don't want you to communicate with me. Now, that may be a little more new to you, although I'm guessing some of you have done some kind of marketing, maybe some kind of email or text, so you might be a little bit more familiar with it. But with HIPAA, it's really around confidentiality and how we control the privacy of our information. And the other main regulation is the TCPA, which we'll talk about, which is the one that's really about phone and text and fax and people's right to be able to say, I don't want you to contact me. So we'll sort of dig in on how those work. So I probably don't need to tell you this, but the Health Insurance Portability and Accountability Act is the act that really provides the rules around how we use and disclose PHI, or protected health information, right? So how and when we can disclose it, the ways you have to protect it, what a patient's rights are in relation to accessing their information. When it comes to text messaging, really what we're thinking about is how do you protect PHI, whether it's in communications with the patient or in working with a business that's going to help you with patient communication. Again, probably information you know, but we'll recap it just to be safe. Who has to follow HIPAA? Who is covered by HIPAA? Obviously covered entities, so that's going to be practices like yours, and business associates, so companies like mine that provide services where you might have to have access to protected health information. And it's really important in those cases that you have a business associate agreement, or BAA. And really what that does is it kind of clearly outlines the permitted and required uses and disclosures of PHI. So let's say you want to have a service do text reminders for you. What information do you need to provide for that to happen? And making sure that that's kind of covered in this, and that the business associate is taking all of the necessary precautions to protect that patient information. So once you have signed that agreement, that business associate is covered by HIPAA and needs to take those same precautions. When it comes to patient communication, HIPAA says you can communicate with patients electronically as long as you have reasonable safeguards in place. So you need to make sure you're using up-to-date and accurate information like email addresses, and updating email addresses and phone numbers in a timely way if a patient lets you know there's a change. And you do need to adhere to the minimum necessary standards. So in the example that I gave around, say, a text reminder, probably all that company needs is when is the appointment and what is the contact information, right? The patient's name. If those text reminders contain additional information based on appointment type, then that might include the appointment type. If you are going to be doing more targeted communications, where it is both the patient's name and contact information as well as a diagnosis or an appointment type or some, so it's really what's the minimum amount of information needed to be able to complete that task. So PHI and unsecure texting. This is obviously the one that most people are concerned about, and luckily the federal government has made some very clear statements just this year about the disclosure of PHI and the use of unsecure text and email. So at HIMSS last year in February, they made a very clear announcement at an event there saying, here's the deal. You can use unsecure text and unsecure email as long as you've made the patient aware that it's unsecure and gotten their consent to do that. So the way it works essentially is patients can send you whatever they want. They can text you or email you PHI all day long. They can send you pictures. They can talk about their health issues. I mean, they can go and go. Now, granted, we don't see a lot of patients necessarily getting into that level of detail, but they could. They can go crazy. You just can't reply and continue that conversation without their permission if that conversation is going to include PHI. So you need to make sure the patient's aware that you're using an unsecure communication method, using some kind of HIPAA consent tool or standard language that allows you to shoot that out to them saying, hey, I'd love to continue this discussion in more detail, but this is not a secure way to do that. Do you still want to carry on this conversation using this channel? The person says yes, great, you can continue that conversation. If the person says no, that's when you need to think about what are the alternate options we have to be able to have that communication through a secure channel. So that may be through a portal, it may be through a phone call, and maybe you encourage them to come in for a visit. What we have found in the time that we've been doing this is that the majority of patients really like the convenience of just real two-way texting and are happy to give their consent to be able to quickly finish that conversation and get the information they need and move on. Most patients would prefer to do that as opposed to having to do some other more cumbersome task to be able to continue that conversation. So that's really the HIPAA piece, and that's the piece around PHI, and those are the important things to remember there. There is also a piece with HIPAA around marketing communications that you need to have patients' consent to be able, or you need to have a pre-existing relationship with them or transactional relationship with them to be able to send them that kind of marketing content, or you need to have their permission. When it comes to email, you can send, once you have that relationship, you can send marketing types of communications via email. The TCPA actually has another level. So if you're familiar with the rules around email and you're used to being able to send those kinds of marketing messages or billing messages to patients through email, text is a little bit different. So we're going to kind of walk through some of those differences so you can understand how that works, because you do need to have consent from patients to be able to do marketing or billing through text. And that is a slightly different thing than email, which a lot of you probably are already familiar with. So the TCPA regulates how you can contact people through phone, fax, and text messages. In general, it requires consent. It requires a clear opt-out, and there are some pretty clear penalties for violating that. There is a difference, though, for healthcare. So unlike email, where it's about pre-existing relationship, in the TCPA, there are exemptions for specific things, and one of those exemptions is for healthcare-related messages. So having a pre-existing relationship doesn't necessarily mean that you can contact someone via text, but having a healthcare relationship where someone is a patient or has just become a patient or has reached out to you for more information, now if it's a healthcare-related message, you're okay. You can send those text messages. What qualifies as a healthcare message are things like appointment reminders, recare or recall reminders, pre or post-op instructions, lab results, prescription notifications, home health instructions, any kind of, pre-appointment or post-appointment information about their actual appointment or their condition or things they need to do. Those are healthcare messages. So one of the things that often comes up is you'll notice that billing is not on here. Billing is not considered a healthcare message, and we're going to talk a little bit more about that as we kind of move forward. So you do want to make sure it really is a healthcare message. It's about their appointment, their upcoming appointment, or a need for an appointment. It's about preparing for their appointment or taking care of themselves after an appointment or after having a procedure, or something in relation to following up, like lab results or prescriptions. So something like this, it's time for your annual exam. That would be considered a healthcare message. Reminder confirming your appointment tomorrow at 1. That's a healthcare message. You do not have to have express written consent to send those messages. Those are covered under the healthcare exemption. Where you do have to have express written consent is around marketing messages. And marketing messages would be things like, we want to send a text message about a new service or an event or a special offer, or billing. So billing is considered a marketing message. You can't send someone a text message saying, you have a balance due, please remit payment, or you have an outstanding balance of XXX, anything like that. You can't send anything like that without express written consent. I have talked to practices who say the way that they get around that is they just send a text message saying, hi, Bob, could you please call Mary at our office at extension 4? And that's how they do that. So somebody has an outstanding balance and they haven't been able to reach them, and they'll send them a text message saying, hey, can you call Mary at extension 4? I talked to one practice that said they reduced their outstanding receivables by 15% just in the first couple of months of doing that with text. So there are some workarounds there, but I will say one of the things that you should expect to see really hit healthcare in the next year or two is text-to-pay solutions. And if you want to use a text-to-pay solution, which can be incredibly effective, you want to be able to send an actual bill or invoice or text message that says you owe XX dollars, click here to pay. To do that, you do have to have express written consent. So one of the things we recommend is just somebody becomes a new patient and you send them an email, or you have them do something on their forms when they check in where you actually ask them, is it okay for us to send you these messages via text and email? And you get their consent, and that kind of covers you. Just make sure that you've tracked that in the software that you use for those kinds of communications, so that when you want to send those kinds of messages, those people have selected text and they've said it's okay to reach out, and you can do that. And that's really where technology plays kind of an important role in this, right, is the ability to ask patients how they want to be communicated with and be able to mark off this person wants to be communicated with via email or text. And then has this person given consent to receive marketing messages via text message? Click yes. And then that's sort of tracked in there, and you can do targeted messaging out to different groups, and you don't have to worry about whether or not somebody's giving consent or not. There are some other things around both email and text. The opt-out obviously is important, but also making sure when someone opts out that is taken care of within a specific period of time, the sooner the better, and that you maintain that. Those are sort of important additional pieces to that. So this is not a healthcare message. This is considered a combination message, which falls into the category of marketing messages. So if you were just saying it's time for your flu shot, you'd be good. If you're saying it's time for your flu shot, self-pay patients get 20% off, that becomes a combination message, which is considered a marketing message. So just make sure that you've thought about that. If you have not been tracking those consents or you're not sure, just stick to the basic, it's time for your flu shot or it's time for your annual exam. If you have been tracking that information and you've got the software to be able to target those messages, and you can send this message to the people who've said, yep, it's okay for you to send me marketing messages, great. You know, send them the ones that are more like offers and services and events and all those kinds of things. But if you're not and you're wanting to be cautious, just stick with the basic healthcare message to make sure you're covered. So there are some best practices to make using text in your practice a little bit easier. As we've talked about, one of them obviously is using a solution that's set up in a way that allows you to easily track the patient's preference around how they want to be communicated with, and also how often, you know, when you've got the software to be able to say, this person just wants to get reminders the day before or things like that. That's really helpful. Being able to text enable your landline so that when you send either an automated or real-time text message out to the patient, it's actually your phone number that shows up, is really helpful because a lot of patients have their providers in their phone, right? So it's going to show that it is Alpine Clinic who is texting them, which is great. And they won't get those little short codes that a lot of systems have where you kind of get the short code that's like, you know, 103342 or whatever, and you don't know what that is, and you've got to go in and kind of read it, and that it says, you know, text 3 or whatever. This is like they can see it's coming from your practice, and they can respond yes or no, or they can send you a question, and that really allows them to kind of have that. The other thing is, because it's so helpful to allow patients to initiate those two-way conversations, right? If it's your existing landline number and it's already in their phone, then it's really easy for them to pull up Alpine Clinic and text you a question. It's, you know, they're not trying to figure out how do I text the practice to find out, you know, if I can get in today. And integrated with your practice management system so that that patient information is there, and, you know, when they're texting, you can see who's texting you because it's pulling from the practice management system. And then just like with regular text messaging, the ability to see the full message history, the ability to, you know, flag a message or prioritize a message, and the ability to do emojis and images back and forth and those kinds of things so that it really is like just real text messaging. You have it on a computer in front of you where you have all this information, but for them, it's really just feels like real text messaging back and forth with a friend or a family member. So, the take-home points here, really, it's ideal to get written consent for text and email communications as a best practice just to cover yourself and be able to send whatever kind of communications you want to send to patients without having to worry about that. It's also obviously ideal to have software in place that allows you to track that and make sure that you're compliant. So if patients say, no, I don't want to get marketing messages, that person's marked that way in the system, and you're not going to accidentally send them a marketing message through text when they've said they don't want that. Or if you just haven't been able to get consent, you know, sending messages to people you don't have consent for. So the best practice is to have tools in place that allow you to have that consent. And then to just be familiar with and follow the rules. They're not that complicated. And, you know, really it's once you understand what they are and you have the tools in place to be able to be compliant with the rules, it should be pretty easy. You know, the right software should also provide you automatically with things like the opt-outs and having your contact information and emails and text messages when you need to and all of those kinds of things. So, you know, obviously partner with vendors who already know the rules and follow them and try to provide those safeguards to help you stay compliant so that you're not having to build all of that from scratch. I mean, that doesn't make any sense. Who wants to, rebuild the wheel? And again, like we mentioned, something that text enables your landline and integrates with your practice management system is going to simplify the process and make it easier for you to send messages to patients, but mostly for patients to send messages to you, right? To be able to save your landline number in their phone, send you questions, and for you to be able to see who it is because their phone number is in your practice management system and the two systems are integrated together. Anything you can do really to streamline and simplify, and I think we all know, across healthcare, that using integrated systems that work together always makes more sense than using disparate systems that aren't connected. So again, I would say if you have, if you really want to talk about more unique, specific experiences in your own practice, or you have very specific questions about things you'd like to do in your own practice, it's always a good idea to talk to your healthcare attorney and run those ideas past that person. But ideally, you can really read through and understand these rules, look them up for more details online, and it's not that hard to be compliant once you kind of know what those rules are. So I think, so who we are, Solution Reach. So Solution Reach obviously provides these kinds of solutions and helps to cover sort of all the aspects of patient communication. And we do provide two-way texting, which is why this is an area we spend a lot of time educating people on. And if you're interested in learning a little bit more, you actually can access our online community, which is where our customers go for information. Our knowledge-based articles provide a lot of really good content around these kinds of things, and you're welcome to check that out and see if there's more information in there that you find helpful. We like to make that available to people just so that if you were interested in looking into Solution Reach and you want to know more about us and more about the support that we provide to our customers, you can do that here. But it's also a great place just to get more information about these kinds of topics. And of course, we're happy to answer questions. So feel free to email us or call us or connect with us on social media, and we'll do our best to answer questions and be helpful. Okay, and I think we'll go back. I'll go put that back up just in case anybody wants to write that down. So I think, Chad, that's all I've got. Perfect. And I'm happy to answer questions.
So first of all, Leah, thank you so much for that great information. And, we make these educational seminars intentionally, but I'm always bringing in partners like Solution Reach because they provide great solutions. And the services you provide are completely tangential to what we offer at Advice Media, but they're so relevant to the overall practice health. And it's interesting, one of the questions that came up was, what are the best tools for connecting my main office line with text service? That's what Solution Reach does. They're one of the companies that does that. That's not just what they do. The appointment reminders is where they got their start, but they have a lot more that they offer today. But one of the great things about them, and one of the reasons I refer a lot of my clients to them, is because they've already integrated with so many of the EMR systems. So as Leah talked about that, you don't want that disparity between one system that doesn't talk to another and you can't track it. They've already taken care of that. That's huge, and I hope everyone recognizes how important that is for your practice. So thank you very much. A couple other questions that came up is in regards to the forms. So do you have examples of specific language that needs to be added to the onboarding forms so that as those new patients come in, or existing patients when they come back in for another visit can have that updated language? Is that something they just need to cover with their attorney in their own state?
Yeah, I mean, I would cover it with your attorney in your own state based on how your forms are set up now. Solution Reach offers the ability to shoot out an email to new patients and ask for that consent via email for people who don't have that set up in their forms. And we often recommend that as an easy way to kind of handle that. And because everybody's practice is a little different, and because what you want to cover is a little different, we try to sort of stay away from offering exact language for putting into your current onboarding forms. But I have seen other examples online. I just always think the best thing to do is talk to whoever you get advice from already around the best way to word that and where to put it on your forms and those kinds of things, based kind of on your personal experience, or use a tool like Solution Reach that provides you with an email, provides you with some way to do it automatically. So you sign up for Solution Reach and you want to send some kind of consent form out to everybody, you can do that.
Perfect. And just so everyone's aware, we do have our control panel here. I should have mentioned that at the very beginning. So if you do have some additional questions for Leah, please go ahead and enter those in, and I'll pass those along. In regards to getting that consent, what have you seen that works well for going back to your existing client database and now securing that permission from them? Do you have to call them? Can you email them? Yeah, what do you do?
That's why we kind of set up the process with the email, is because we think that's probably the most effective way. Obviously, there's a challenge sometimes for practices that maybe have a large patient database where they have not been collecting email addresses, and that adds another layer there. But if that's the case, if you haven't been collecting email addresses and or cell phone numbers, I would say the first thing you need to do is to start making that a standard part of your check-in process. So you might have to spend some time doing some updating in your check-in process to gather email and cell phone numbers. And if you're going to be doing that anyway, you might just say, hey, we're doing a forms update. You might just pick a date and say, we're doing a form update and we're collecting now emails and cell phone numbers and some additional information. And you might just go through a 6-month or 12-month period where you have every patient do updated forms. Because you're going to want to be able to do more than just, it's more than just two-way texting. I mean, we're kind of talking about patient communication in general and how patients want to be communicated with. By gathering those emails and cell phone numbers and asking patients, how do you want to be contacted, you could potentially see a pretty significant improvement on things like reminders and recall and other kinds of communications, reviews, anything that you might be sending out by switching to using text. And if you're not collecting those now, you're going to need to go through that process to be able to start sending more text messages and or email communications.
I think that's critical. I think make sure the audience understands what you shared on that information is they can't just send out a text message as a first time and saying, hey, does this count as your opt-in? And who goes for it and doesn't, right? It's like you got to get permission before you do that first. I should say the marketing one, right?
I do think more practices now collect email addresses, but I still run into practices who have not even started that process yet, who still are doing a lot of things in a pretty traditional way, mostly using postcards or phone calls. And so that's something I think as a practice, you have to say, we're just making it a priority to start collecting emails and cell phone numbers and to make this transition. And I think you'll be pleasantly surprised by the response from patients, which is what I generally hear from practices. Patients saying, I love this, it's so great to get text messages. It's just a better experience for patients. So they're happy to do it if even if it takes you a little while to gather all that information.
I couldn't agree more. I think one of the things you said that I think is one of the most valuable or meaningful pieces is thinking to the future, right? The ability to not only enhance communication, which people are looking for that touch to be communicated in the way they want to be communicated with. And listen, I'm one of those. I don't listen to voicemails. I see that you called, I'll call you back. And someone's like, did you get my voice message? I'm like, yeah, but I didn't listen to it. So well, what you got? And they're like, oh, and I just don't listen to voicemails anymore. I don't. I do call back, but I don't listen to the voice message. But more than that was the text to pay feature, the ability to just give convenience to the patient is critical, and it's going to grow. And so you need to get that in place today so that as this really becomes the absolute, we already know it's moving towards that. You have the great information to back it up. It's going to become the overwhelming way that people want to communicate is via text. And it is,
and I think in addition, so we're going to be launching a text-to-pay solution probably heading into next year. But we have also talked about the fact that, the industry is moving so heavily to text and mobile that at some point we're probably going to start seeing some kind of telehealth texting component. I don't know what that looks like exactly, but it's certainly something that we're watching and that we're talking about, that eventually there are going to be more clinical applications for even just, two-way texting, or solutions where maybe you are just clicking on a link that helps secure the interaction, but there's not all this logging in. I mean, I just saw on, I just read an article the other day that was yet another study about patient portal use, and yet another time somebody, is providing data saying only 30-some-odd% of this patient demographic uses portals, and portals are not that effective. And honestly, from my perspective, after 20 years in this industry, it's about the logging in, it's about
right.
that everything. So mobile has now surpassed desktop in terms of user
right.
experience, right? Most people are using mobile. And it's really a pain to log into stuff on mobile. And a lot of portals and portal-like solutions are not designed for mobile, so it makes it even more challenging. And so it's important to be thinking today that over the next probably 2 to 5 years, a lot of things we do on desktops or that we've thought of as desktop applications, people are going to be innovating and disrupting and looking for ways to make those mobile/text-enabled tools and options for people. And patients are always much further ahead than we are in terms of practices in what they'd like to have, or what, they'll see something and be like, oh yeah, I wish I could do that with my doctor. They're going to want that. So be preparing now for all those things that are going to be coming over the next few years, because it'll be a lot. There'll be a lot of innovations happening for mobile and text, I think.
I think you're absolutely right, and you're at the forefront of that. A few questions that came in that were a little bit similar, and I'd love to get your input and maybe some numbers you've got on this as well. They're worried about the amount of extra time or random texts coming in and having to get to these, and patients wanting this information. I think if I'm reading through these questions, it's that Pandora's box, right? If we open it up to allow patients to get in touch with us, what are we really opening ourselves up to? And is it one of those things that, oh my gosh, why did we start that?
Right.
What would you say about that?
So luckily, what we've found is that's not the case. So what we have found, what we've heard from practices that we work with who are using text, is that texting first is so much faster than phone calling that not only are they seeing a lot of phone call drop off, right? They're getting a lot less phone calls, but the process of texting is a lot faster and less invasive for the practice. So, a patient texts you, there's a pop-up on your screen that says you have a text from this patient. If you're checking someone in or you're doing something, you can finish that and then you can text that person back. So it's less disruptive than phone calls coming in that you have to pick up and answer. But it also is much faster. So the average phone call takes about 2 minutes. The average text message takes about 4 seconds to send. So the patient sends something saying, I'm running 5 minutes late. You text back and say, okay, I'll let them know. And that's it. I mean, it's really, it's fast. So that's one thing. So one thing is that it's less disruptive. It tends to be much faster and more streamlined. The other thing that we have found is that, people worry a lot that the providers will end up answering a lot of questions on text, and that it's going to be like 24 hours a day, and there's going to be all this kind of disruption with text messages. So we have not seen that. What we have found is that most people's questions tend to be the kinds of things they would call about. So, directions. Do you take my insurance? Can I get an appointment today? I left my cell phone in the exam room. It's like the stuff that they would have called before or after. So your office staff are the ones who feel the most kind of significant improvement in terms of the majority of those text messages being around more administrative kinds of things that they would be doing on the phone and now can do much faster via text. The other piece of that is that you actually can set up some standard responses. So like for directions, you can actually set up a thing where you just click a button and it sends the directions. You don't have to retype the directions every time. So for those kinds of standard responses, you can preset those, which is a big time saver. We don't see a ton of people texting in with clinical questions. And when they do, they tend to be pretty quick. They tend to be, you can say like, yes, you should come in. We've often recommended that practices who do get a lot of clinical type phone calls, like pediatrics, set up some kind of triaging system where someone is they may already have a triage nurse. Now you're essentially doing the same thing there that you're doing at the front desk, where you're moving some of that triage to text, and it does tend to actually be faster. And then outside of regular office hours, you can set up messages on your text messaging that say, our office is not currently open. We're not responding to text messages. If this is an emergency, call 911. Same kind of stuff you would put on your phone message. So you don't need to feel like because you've turned on text messaging and text messaging is thought of as being a 24/7 thing, that doesn't mean you have to be done text 24/7. You can put up those automated responses, our office is closed and here's what you do, like you would on your phone or anywhere else.
And that's the advantage of having a great smart system, you said. So, yeah, it's awesome. Again, Leah, thank you so much. Really appreciate your time and everyone else's time for joining us today. Absolute pleasure to have met you and appreciate you and the knowledge you've shared. For everyone here, this is and has been recorded. Our team will be processing that. We'll have it uploaded on the Advice Media website tomorrow, as well as our YouTube page. And it will go out as an automatic reminder, through the GoToWebinar system, and we'll send it to you as well. But again, we appreciate everyone's attendance. Leah, cannot thank you enough for all of your information today. Wish you the best in your travels, and wish all of our listeners the best.
You too. It sounds like you guys are very busy, and to everyone out there heading into trade show season, safe travels, and thanks so much for having me.
Thank you. Have a wonderful day. Bye, everyone.